This is the GYFL emergency plan. Number one, on the form, write down the practice location, the name of the field, and then write the specific address so that when you call 911, you have the specific address and you do not have to think about it. Write down the evacuation site in case of an emergency or bad weather. This should be an indoor area if possible, and write that down on the form. Also write down all the coaches' names and phone numbers, and then designate an in-charge coach or manager. The duties of that designee will be to make the 911 call and tell the EMS, the ambulance folks, exactly where to go. That person will be in charge of either giving care to that athlete or designating another person to give care to that athlete. They will be responsible for the contents of the first aid kit, and very important, the emergency cards. Those are the cards which have the athlete's name, the date of birth, any medical conditions, any medications they're on, and any dispensing information regarding those medications. That is very important information, and that is information that must be given to the EMTs should that emergency call need to be made. You must have a working cell phone. Please charge those batteries. That person will call the parents or guardian of the injured athlete. They will complete the injury form, which will be the next video that will explain that. And then that person will travel with the athlete or designate a person to travel with the athlete to the hospital. How to make that 911 call. You want to instruct the EMTs to report to the specific location, hence the need for the specific address, and say that there's an athlete in need of emergency medical treatment. You want to describe the injury and any treatment given so far. You want to give any other information requested by that dispatcher, and very important, do not hang up until the dispatcher tells you to hang up. Provide appropriate emergency care until the arrival of the EMS, and upon arrival of the EMS, please provide the EMS folks with the information on that athlete emergency card or medical card and the continued treatment that's been given. The coach or parent will be notified and should accompany the athlete to the hospital and notify the parents. The on-the-field injury assessment, very basic. Number one, please do not remove the helmet. If CPR is necessary, you can cut the cord in between the pads to expose the chest. You can cut the shirt, the uniform of the athlete, but please do not remove the helmet, because should there be a potential neck injury, the removal of the helmet could injure the cervical spine, the neck further. You want to see, is the athlete breathing? If not, call 911 and start CPR. Is the athlete bleeding? If yes, apply compression to the area. Please use gloves while doing that and hold that compression until the bleeding stops. Is the athlete able to move? If not, please determine if it is safe to move the athlete. In other words, if you suspect any head, neck injury, spine injury, one person must stabilize the head and neck and wait for the EMTs to arrive. In this case, do not move the athlete. So if in doubt, don't move the athlete. If you're 100% sure that the athlete can be moved, please help him off the field and evaluate on the sidelines. This will most certainly help with crowd control and parent control. Contents of the first aid kit, that's shown in the video prior. It's the bag, the clipboard, the emergency cards, the injury form, gauze pads, gauze wraps, band-aids, pair of scissors, hydrogen peroxide, some antibiotic ointment, some iodine prep pads, gloves, tape, and tongue depressors, which can be used as finger splints for finger injuries. Concussions. An athlete does not have to lose consciousness to have a concussion. If a concussion is suspected, please take the athlete out of the game or practice immediately, and there is no return to play during that game or practice. The athlete must have a medical evaluation and be cleared by the physician before he can return to practice or a game situation. Concussion signs and symptoms. Signs are what you as the coach see. So is the athlete dazed, confused, forgetful? Does the athlete move clumsily? Are they mentally slow? Do they answer questions slowly, or do they slur their speech? Are they unconscious? Is there a behavior or personality change? And symptoms, what the athlete reports: headache, nausea, balance problems, which can also be a sign, Dizziness, fuzzy vision, sensitivity to light. Are they sluggish, foggy? Is there confusion? And there's their memory loss of events prior to and or before the hit. Concussion emergency call. In other words, if you see these signs and symptoms, call 911. Decreased level of consciousness, unusual drowsiness or ability to be awakened, difficulty getting their attention, if there's breathing difficulty, severe or worsening headache, persistent vomiting, and seizures. Bottom line, if in doubt at all, call 911. Heat injuries. As you can see, the signs and symptoms of heat injuries can be similar to concussions. So if you don't see the trauma, you may want to call 911 just in case. Cramping, dizziness, headaches, nausea, profuse sweating, fatigue, rapid pulse, and lightheadedness are all signs and symptoms of heat injuries. You must move the athlete to a shaded or cooler area. That's why those pop-up tents are critical to have at the practices. Place the athlete in a cold water bath, or at least use ice at the base of the neck, the groin, the armpits. Elevate the legs. Have the athlete sip cold water. Monitor their vital signs, in other words, their respiration rate, their pulse, and monitor their level of consciousness. If the pulse and the breathing rates increase, if the athlete feels faint or loses consciousness, call 911. Wound care, cuts, lacerations, abrasions. Please, coaches, wear the gloves provided in the first aid kits. First rule of first aid, don't hurt yourself. It doesn't help for the person helping to have an injury. Clean the wound with bottled water. Just pour it over the area. Then you can clean the wound with some hydrogen peroxide by just gently pouring it over the area. Cover lightly with the gauze and the gauze wrap and put some tape on it and have the athlete properly evaluated. Sprains and strains. In other words, if something hurts, the athlete comes out of the game. You can ice the area for about 15 minutes with gentle compression and elevation. If it's really bad, you can splint the area if necessary, and the athlete will not return to play. Remove the ice after 15 minutes, and the athlete can continue to ice for 15 minutes every 60 minutes. Return to play guidelines. If in doubt, take him out and keep him out. That is the rule for the GYFL. The injured area must be able to do what the uninjured area can do with no pain or swelling. In other words, if it's an elbow injury and the left side is injured and the right side is okay, see how much the right side can bend and compare that to the left side. If the left side cannot bend as much as the right side, then the athlete cannot continue to play. There is no return to play if there is pain, swelling, bruising, or bleeding. You must have the athlete see a doctor and get clearance before the athlete can return to play. And finally, the inclement weather or lightning policy. At first sign of lightning or sound of thunder, the athletes must be removed from the field of play and brought to that emergency location, preferably inside. Practice is suspended until 30 minutes after the last sign of lightning or sound of thunder. Thank you. Any questions, please contact me, Dr. Steve Horowitz, at painfree123@gmail.com. Be safe.